9 effective solutions for sciatica pain. Sciatica is leg pain caused by a pinched nerve in the lower back. Although the pangs begin in nerve roots located on either side of the lower spine, they then course through the sciatic nerve, which runs the length of each leg from the buttock down to the foot. The leg agony, called radiculopathy, is often worse than the back pain, says William A. Abdu, 1500th, medical director of the Spine Center at Dartmouth-Hitchcock Medical Center. The most common cause of sciatica is a herniated disc. When a disc develops a tear or crack and bulges into the spinal canal, it can pinch the sciatic nerve. Usually, symptoms clear up within about 6 weeks, but for some people, the pain can last far longer. Ready to start feeling better? Here are a few treatments worth trying. Chiropractic care. 60% of people with sciatica who didn't get relief from other therapies and then tried spinal manipulation experienced the same degree of pain relief as patients who eventually had surgery, found a 2010 study in the Journal of Manipulative and Physiological Therapeutics. The 120 people in the study saw a chiropractor about 3 times a week for 4 weeks and then continued weekly visits, tapering off treatment as they felt better. In people who responded to chiropractic care, benefits lasted up to a year. Acupuncture. A small study in the Journal of Traditional Chinese Medicine found that of 30 people with sciatica, 17 got complete relief and 10 saw symptoms improve with warming acupuncture, in which the needles are heated. Yoga. A study in the journal Pain reported that people with chronic back pain who practiced yoga for 16 weeks saw pain reduced by 64% and disability by 77%. Although yoga's effects on sciatica are less clear, gentle forms may be beneficial. By strengthening muscles and improving flexibility, yoga can help sciatica sufferers move and function better so they don't fall into a posture that aggravates the sciatica. Trigger point massage. The sciatic nerve sits underneath a muscle called the piriformis, which is located beneath the glutes. When the piriformis muscle gets tight, it pinches the sciatic nerve, causing tingling and numbness down into the leg, says Smoot. He applies pressure to irritated and inflamed areas, or trigger points, in the piriformis muscle, as well as in muscles in the lower back and glutes. Typically, Smoot schedules treatments 7 to 10 days apart. If patients don't see progress by the 4th visit, they need to try another form of therapy, he says. Ice or heat. Because the sciatic nerve is buried deep within the buttock and leg, ice or heat on the surface of the body won't ease that inner inflammation. But the time-honored treatments can act as counter-irritants, that is, they give your body other input in the painful area, and that brings the pain down a notch. Pain relievers and muscle relaxants. Taking a non-steroidal anti-inflammatory drug, either OTC like ibuprofen or RX, can ease the distress. Because painful muscle spasms may also accompany a disc herniation, doctors sometimes prescribe muscle relaxants or pain-reducing tricyclic antidepressants. A caveat: these won't help with the pain caused by pressure on the sciatic nerve, says A. Nick Shamey, MD, a spokesperson for the American Academy of Orthopedic Surgeons. Epidural steroid injections. People whose pain doesn't lessen within about a month and who aren't helped by other therapies may find their pain remedied by an X-ray guided injection of steroid into the lower back near the sciatic nerve, says Raj Rao, MD, a spokesperson for the AAOS. The hope is to reduce inflammation within that nerve branch, explains Rao. Because of concerns about side effects, such as loss of bone density, the epidural shots are limited to 3 a year. Exercise and physical therapy. Moving is usually the last thing people dogged by sciatica want to do, but it's important to be physically active. Lying in bed makes it more likely that the pain will last longer, says Ruppert. Exercise increases blood flow to the disc and the nerve, helping to get rid of the chemicals causing the inflammation. Take 15 to 20-minute walks. If that hurts too much, give swimming or water aerobics a try. There's not as much pressure on the back when you're in the water, says Ruppert. It may also be worth seeing a physical therapist, who can prescribe stretching exercises to restore flexibility to the back or moves that strengthen core muscles, helping to stabilize the spine and reduce the likelihood of a similar injury. Surgery. After 4 to 6 weeks of unremitting symptoms, patients may qualify for surgery. The Spine Patient Outcomes Research Trial found that those who had surgery for a herniated disc had greater decreases in pain and disability 3 months afterward than patients who did not. The benefits lasted up to 4 years. Each of these home treatments can be effective, but you shouldn't just choose random treatments for your pain. Instead, it's important to choose the right treatment for the underlying cause of your sciatica, or your pain may worsen or at best, not improve at all. Fortunately, a sciatica expert has recently released an online program teaching you how to cure sciatica pain in less than 7 days, from the comforts of your own home. The course also contains a list of the 7 most powerful home remedies to naturally eliminate sciatica pain. Click on the link in the description to get started today.